Dentists are involved with treating sleep apnea. Primary reason is that sleep apnea, as you know, is a medical condition diagnosed by a physician, sleep physician. But the treatment that is offered in the medical community is a CPAP. It's very effective for those people that wear it. Unfortunately, the compliance rate is relatively low. And so that's where the dental appliances and dentists come in, is we have an alternative for people who do not wear the CPAP, or for people who are mild to moderate, where an oral appliance will be comparable in effect to a CPAP, and oftentimes people feel it more comfortable and advantageous to wear it that way. Okay, oral appliance is relatively simple in how it works. It's basically a mechanical device to help keep the airway open during sleep. I've used this, what we call an airhead, in the office for patients, hundreds of patients, and they seem to understand it very well. But it'll show, like I'm sitting here, or we're sitting here talking upright, we're able to breathe comfortably through our nose, comfortably through our mouth. Airway is open here, no snoring, no problems. When we go to sleep, things tend to change, and usually it's worse on the back. It certainly was for me when I was diagnosed with sleep apnea. The tissue in the palate of our area tends to relax and become more pliable and droop some. The lower jaw tends to relax, and the tongue along with that. And everything tends to sort of drop back. And in our throat, we tend to get a clogging of the tissues of the palate and the tongue. And that narrows or totally closes the airway. A CPAP doesn't prevent the airway from closing. All it does is, either through a nasal pillow or a full mask, it forces pressure. CPAP means positive pressure, and it forces the air through that obstruction. The lab technicians at a sleep lab will titrate that to the right level to get through there, but it doesn't prevent the airway from closing. It just gets through there. What we're doing with an oral appliance is that we're trying to stabilize the lower jaw position, like this, so that during sleep, especially on our back, our lower jaw is stabilized, it doesn't drop back, and in doing so, that we stabilize the tongue position. So instead of all this tissue clogging up in the throat and closing the airway, we're able to keep that airway more open. And in, like I said, in mild to moderate cases, usually the effect of this is comparable to a CPAP level. In very severe cases, it's difficult for the oral appliance to do as well as the CPAP, but oftentimes in severe apneas, the pressure levels have to be set so high, as I showed, to get through there, that it's very uncomfortable to wear. And so oftentimes we have patients that are severe that do an oral appliance and a CPAP together, because you can see the oral appliance will keep the airway more open, thus the pressure level of the CPAP can be turned down to a more tolerable, comfortable level, and the two together are oftentimes much more effective than either alone.